Question number 2, Anas Sarwar.
Last week I raised the case of Robert, a retired policeman from Lanarkshire who spent 5.5 hours on the floor in A&E before being given morphine and a bed. The First Minister apologised, but as usual he then used hard-working NHS staff as his political shield. Well, today the Royal College of Nursing has published a damning report that lays bare the impact of the crisis on NHS patients and staff, with one nurse saying, "I deliver care in inappropriate settings every single day, all day. It deprives the patient of privacy and dignity. It forces us to go against our codes and training." This is shameful. Last week, John Swinney apologised to patients. He's just done it again today. But will he now apologise to the NHS staff that he and his SNP government are failing every day?
First Minister.
One of the key points that I've tried to stress in all of my answers to Parliament on this question is the importance of ensuring I address the circumstances that we face in our hospital system as they are. And that's one of the reasons why I went to see the emergency department at the Royal Infirmary on the 4th of January to see with my own eyes the pressure that was being recounted to me by health service leaders over the course of a number of weeks where I was engaged in trying to address this situation. I think we all accept, ministers throughout the United Kingdom, the pressures that are on the National Health Service because of winter circumstances. And I've recounted to Parliament the enormous increase in flu cases. So let me, for the record, put those numbers on the parliamentary record. Hospital admissions nearly doubled from 708 in the week ending the 15th of December to 1,382 in the week ending the 22nd of December, and they increased further to 1,596 in the week ending the 29th of December. Now, that's when this survey was undertaken. So I acknowledge the reality of the pressures, the intense pressures on the National Health Service. We have expanded staff numbers, we've expanded consultant numbers, we've expanded the capacity of NHS 24 as a review of urgent care called on us to do back in 2020, and we have done that. And the Government will still continue to take all of the steps necessary to make sure that our staff are as well supported as they can be in dealing with the intense pressures that prevail in winter time within the National Health Service.
Mr Sarwar.
John Swinney wants to pretend that we just have a winter crisis in the NHS. The reality is we have a permanent crisis in the NHS on John Swinney's watch. And the RCN report details the human cost of John Swinney and Neil Gray's incompetence. Nurses are delivering care in overcrowded or unsuitable places like corridors, cupboards and even car parks on a daily basis. Staff are caring for multiple patients in a single corridor, unable to access oxygen, cardiac monitors and other life-saving equipment. Patients are going into cardiac arrest while in a corridor. Incontinent patients are left with no privacy, and almost 90% of nurses say patient safety is being compromised. Nurses describe flu patients waiting in corridors next to vulnerable patients, or having to discuss their miscarriage with a couple in an overcrowded corridor. One nurse said, "I worked throughout COVID-19, and although that was a horrendous experience, this lack of care in the broken system is worse." Isn't this the deadly reality of the NHS on John Swinney and the SNP's watch?
First Minister.
No, it's not. What we are doing is we are focusing within the resources available to us on maximising the effectiveness of patient care for individuals. So what has the Government done in recent years? Well, the Government has, for example, increased NHS staffing by 26.6% in the period in which we have been in office. So in Mr Sarwar's central point to me in his last question, the Government has increased staffing numbers. We've increased consultant numbers, particularly in emergency care. We've also increased the capacity of NHS 24. We've introduced innovations such as Hospital at Home to ensure that more patients are treated in the circumstances that best meet their circumstances. So the Government will continue to innovate and reform to address the needs of the public. But there is a harsh reality about the increased demand that we are facing as a consequence of the upsurge in flu cases, the implications of COVID, which has left the population facing more acute health circumstances than pre-COVID. And obviously the government is prioritising the National Health Service by ensuring that we're investing the largest sum of money ever in the National Health Service. And I look forward to the government's budget passing to enable us to secure that investment for the people of this country.
Anas Sarwar.
The RCN in Scotland this morning said, and I quote, "This is a wake-up call for the Scottish Government." But clearly from John Swinney's answers, he's asleep at the wheel. And that's why we need a change of direction in this country. But let's listen. He denies reality. So will he listen to what Scottish nurses are saying? One said, "It is demoralising, frustrating and embarrassing. It feels like patients are a number, not a patient." Another Scottish nurse, "It's degrading and unsafe, and these locations are not designed or intended for patient care and offer little or no privacy." Another Scottish nurse, "I've had to give IV antibiotics on a chair beside the nurses' station to someone septic." Another Scottish nurse, "I'm now in the process of leaving the NHS. It is fraying at the seams and has left me with mental health problems and trauma." This is the damning and sad reality of our NHS under the SNP, and isn't a clear sign that John Swinney and this SNP government can't fix the mess they made, and we need a new direction in our country.
First Minister.
I hear this slogan from Anas Sarwar every week, but I just want to point out to Parliament there wasn't a single word of substance to back up the rhetoric of new direction from Anas Sarwar. And the last word that Anas Sarwar used was change. Change. He argued that a Labour government in London would change the circumstances for people in this country. Well,
Members, let's hear one another.
A Labour government didn't change the circumstances for waspy women in this country who've been betrayed by the Labour Party in the United Kingdom. Now, the Secretary of State for Scotland was in Parliament yesterday and was telling us all that the people couldn't cope with the honesty of the Labour government. Well, I think on the basis of the last few months, what people in Scotland are waking up to is the fundamental dishonesty of the Labour Party, and Mr Sarwar epitomises it.